Hi and welcome back to another video of Medic Notes. This video is on osteomyelitis in adults. Osteomyelitis is the infection of bone characterized by progressive inflammatory destruction and apposition of new bone. Diagnosis requires careful assessment of radiographs, MRI, and determining the organism via biopsy and cultures. Treatment is often a combination of culture-directed antibiotics and surgical debridement of non-viable tissue. Its common locations are at the spine and ribs in dialysis patients, medial or lateral clavicle in IV drug abusers, and foot and decubitus ulcers in diabetics. Risk factors include recent trauma or surgery, immunocompromised patients, illicit IV drug use, poor vascular supply, systemic conditions such as diabetes and sickle cell, and peripheral neuropathy. Osteomyelitis can spread through hematogenous route, which is the most common etiology in children, and vertebrae are the most common hematogenous site in adults. Staph aureus is the most common organism. It can also spread though contiguous, associated with previous surgery, trauma, wounds, or poor vascularity. And third route is through direct inoculation, by penetrating injuries, open fractures, and surgical contamination. Osteomyelitis is associated with ortho conditions like septic arthritis and abscess, and medical conditions like immunosuppression, dialysis, IV drug use, diabetes, poor nutrition, and vascular disease. This is the table showing the different organisms commonly seen in different age groups. Staph aureus is still the most common organism, and there are others like Enterobacter, Streptococcus, Shigella, and Haemophilus species. It can be classified using its timing. Acute osteomyelitis occurs within 2 weeks, subacute within 1 to several months, and chronic after several months. There is the Tierney-Mader classification, based on anatomic location and the host type. Stage 1 is medullary. Stage 2 is superficial. Stage 3 is localized. And Stage 4 is diffuse. Patients typically present with pain and fever. For vital signs, fever, tachycardia, and hypotension suggest sepsis. On inspection, erythema, tenderness, and edema are commonly seen. Draining sinus tract, more common in chronic osteomyelitis. And if able to probe bone through sinus, chronic osteomyelitis is present. For motion, limp and pain inhibition with weight-bearing or motion may be present. Assess the joints above and below the area of concern. For neurovascular, assessment of vascular insufficiency locally or systemically. For blood investigations, check leukocyte count, ESR, C-reactive protein, and blood or bone cultures. For imaging, in acute infections, bone loss must be 50% before evident on plain films. Whereas in chronic infection, findings are bone lucency, sclerotic rim, osteopenia, periosteal reaction, and lysis around hardware. Sequestrum is the devitalized bone that serves as a nidus for infection. And involucrum is the formation of new bone around an area of bony necrosis. There might also be Brody's abscess seen. Other investigations are CT scan and MRI scan. This picture shows a penumbra sign seen on the MRI, where there is a dark central abscess with bright internal wall and dark external sclerotic rim. For treatment, non-operative treatment is antibiotics and hyperbaric oxygen therapy. Operative treatment is irrigation and debridement followed by organism-specific antibiotics. Indications for this are acute osteomyelitis that fails to improve on IV antibiotics, subacute osteomyelitis, abscess formation, chronic osteomyelitis, and draining sinus. Another operative option is amputation, which is indicated in chronic infection with pervasive wound or bone damage that is unable to be salvaged. The complications of osteomyelitis are persistence or extension of infection, amputation, sepsis, and malignant transformation. Seen in 1% in chronic OM, mostly SCC or Marjolins ulcer. Risk factor is chronic draining sinus. And treatment will be wide surgical resection. For prognosis, despite surgical debridement and long-term antibiotics, recurrence rate of chronic osteomyelitis in adults is 30%. Poor prognosis in patients with major nutritional or systemic disorders. That's all for this video. Thank you.